So I think we first noticed something was wrong with Winston when his behavior started changing. So he just wanted to sleep, he didn't want to play. He is usually a very active, playful, crazy dog. And then he would refuse to go on walks, which was a big telltale sign because he loves going on his walks. I called knowing that Dachshunds can obviously have, spinal problems, and just said, look, we're noticing that like his behavior is super weird. He seems to be in pain, especially when we would pick him up.
Yeah, he'd yelp.
Yeah, he would start yelping like he just didn't want to be touched and was very uncomfortable. And that was brand new for us. We had never seen that before.
So the day that we went to 7, it was definitely scary the first time.
Yeah.
He had all those symptoms of not being able to walk. So when we brought him in, they first did a physical exam where they watched him walk and touched him and moved on his back. So they were able to identify exactly where it was hurting him. And then when we made the decision to go for the surgery, they do the MRI and immediately after do the surgery in the same day.
So we received that he was a stage 2 IVDD candidate, that he had 2 herniated discs and he had scar tissue that had formed along the spine. They did say that, given that he was early on in the diagnosis, it would be best to do surgery because those patients have the highest success rate for a full recovery. We moved forward with the surgery and it was heartbreaking because we didn't know what the future was gonna hold and how he was going to be, and we wanted just him to be his crazy, playful self. And you always hear in that moment when your dog needs surgery because it's something with their spine, you don't want them to have a less, quality of life. So in that moment, I think we were just really worried about that. But again, it was the option that we knew would give us the best chances for him to have a full recovery.
Winston's recovery started with the first couple of days when he was home, not wanting to get up at all. And then within a couple of days, we've kind of used a sling to make him walk and support him on his back legs. And I would say within a week of doing that, he was wanting to go on full walks where we'd have to pick him up. And then I'd say within like 2 or 3 weeks after that, he was able to just, start going on a couple walks on his own without the sling. And we'd limit him to crate rest. We had a big baby playpen right here. Then eventually, they gave us stages of graduating from the playpen to a full room to how long they can interact with dogs. And now he's back to running full laps around the apartment whenever he can. I would describe it as, it was a great experience with 7. From the care that he got during the surgery to the explanations and giving us the decisions beforehand, and not just saying, hey, let's have surgery, but really explaining the different options that we had, the different recovery of each, the different percentages of each, and just explaining the odds of what our decision can affect in terms of the recovery rate. It was definitely informative and it was great, and they were able to actually keep him as long as we needed because we wanted to make sure that he was ready to come home.
Yeah.
Not just forcing him to come home early because we wanted him home, and they were able to,
work with us on that, which was really nice.
To make sure that he was ready to come home and be back in the environment because we have a second dog. So we didn't want him to rush here, then play with our other dog or be in an environment where he was uncomfortable. So they were great at, helping us with that and explaining every step of the recovery along the way.
Today, he is 100% himself. He is spunky, he is playful, he is very demanding and stubborn, and he wants his food every day at 5 o'clock sharp, and he will let you know when that is.